What is the process for creating a neobladder from intestine? Imagine turning a part of your own intestine into a new bladder to help you regain more natural urination after bladder removal. That's what a neobladder surgery aims to do, especially for patients with bladder cancer like transitional cell carcinoma. The process starts with removing the diseased bladder completely through a procedure called radical cystectomy. This is necessary when the bladder is affected by cancer or isn't functioning properly. Next, the surgeon carefully selects a segment of the small intestine, usually about 35 to 55 centimeters long. This segment is gently separated from the rest of the intestine while keeping its blood supply intact. Preserving blood flow is crucial to keep the tissue healthy and viable. The remaining ends of the intestine are then sewn back together to restore normal bowel function, so digestion continues smoothly. Once the intestinal segment is isolated, it is reshaped into a spherical pouch that functions like a bladder. This new reservoir, called the neobladder, is formed by folding and suturing the intestinal tissue into a shape that can hold urine. The surgeon then places this neobladder inside the pelvis, in the same area where the original bladder was located. To connect the new bladder to the urinary system, the surgeon detaches the ureters, which carry urine from the kidneys, from the old bladder and attaches them to the neobladder. This allows urine to flow naturally from the kidneys into the new reservoir. The next step is connecting the neobladder to the urethra, the natural channel for urine to exit the body. This connection helps the patient urinate in a way that feels as normal as possible. After these connections are made, the remaining ends of the intestine are sewn shut to ensure proper digestive function. During recovery, a temporary catheter is placed through the urethra to drain urine and help the surgical site heal. Patients are closely monitored for signs of proper urinary function and to address any potential complications. This surgery can be performed through traditional open surgery or with minimally invasive techniques like laparoscopic or robotic-assisted surgery, which often lead to quicker recovery times. Since the neobladder is made from the patient's own tissue, there's less risk of rejection, and no immunosuppressive drugs are needed. However, it does require careful patient selection and postoperative management because adapting to controlling urination can take time, and there may be a higher chance of complications compared to simpler urinary diversions. In cases of bladder cancer, especially transitional cell carcinoma, creating a neobladder offers a way to preserve a more natural way of urinating, which can improve quality of life. It's a complex procedure that should be performed by experienced surgeons and followed by specialized care to ensure the best possible outcome for bladder health and function. Always consult with a healthcare professional to determine if this option is suitable for your specific situation.